Good morning. I'm Sarastika Chaudhary from Air Force Golden Jubilee Institute, and today we have here with us Mr. Amresh, headmaster of our special wing. He is a special educator and is well experienced in this field. After a small talk with him about our special wing, we'll get to know a lot of things about the children with special needs and how we teach them in our institute. So the first question I want to ask you is, what is special education?
See, a child with special needs, when they were looking for schools, they felt like why not they should be included or integrated in a general school. Okay, so special education came into picture to help them to design their curriculum, to help them gain their learning achievements, and to groom them according to the society needs.
So, sir, how will parents know that their children actually need this special education?
Very good question. Thing is that any child who is suffering behind the normal pace of the children age group, of similar age group, or the friends or age mate basically, or if they are developmentally delayed and they are finding difficulty in learning level, in intellectual level, these children comes under the category of special needs, and they can be given good interventions at right age and can be groomed very well.
Indeed, sir, you're doing a very commendable job at that.
Thank you.
But I also have another question. If these kids have special needs, can they actually understand the subjects like English, Hindi, maths like normally kids do?
Yes, definitely. It depends on basically what is their mental age basically, and what is their intellectual level. Like the intellectual age and intellectual level has been defined based on psychological psychometric tests, which are called as intellectual intelligence test. And IQ is the parameter, is the unit on which we consider what is the level of the brain basically. And the IQ are considered to be defined under test batteries, which are psychologically developed, and to define these intelligence quotient. Intelligence quotient are divided into four major categories in which the children with special need comes. One is 0 to 20 is profound delayed, and 20 to 35 is severely retarded, and 35 to 50 is mild moderate, and 50 above to 70 is mild category.
So can we say that different time is allotted to different psychological conditions for children for different subjects?
Not actually that. Thing is that the children who are sufferer, depending on their intellectual level, whether they can cope up with that subject, is that so important? It is parents' choice, and based on that, we define under the IP, that is Individualized Education Program, which is the curriculum designed for these children. IEPs are basically guidance for the teacher and the parents for next coming few days or months, which slab whatever we are fixing, and that slab what will be the parameter on which we will work for with the child.
We're hearing this term IEP a lot of times.
Yeah.
So what will you define its importance to be?
See, IEP is a script basically, a kind of CBSE has a curriculum system, syllabus, likewise lesson plans, likewise a teacher and parents sit together. That multidisciplinary approach, all the teachers and the therapists and parents sit together and they finalize the goals in which area, like speech therapy, physiotherapy, special education, what all areas we will work in which direction, and what slab we will achieve in the coming few months, like within 1 month, what we want to achieve from the child. And keeping the level of the child, we keep the goals. Right, a child is at the age of 6 years, is not able to hold a pencil. We can't compel a child to write 1 to 50 within 1 month. Okay, we'll work initially, the goal will be initially helping the child hold a pencil with the tripod grip, right? And to attain that grip, whatever physical parameters are required, physiotherapy or occupational therapy are required, will work in that direction also. So similarly, a special educator will work on in academic area to attain that particular goal what has been selected. This is what is IEP.
All right. I think one more example will be more informative about this.
Yeah.
So if I may ask, a child who cannot speak out their thoughts, what they need. How do you handle those kids? How do you know what they need and what they want?
Okay, the children who can't speak comes under the non-verbal category, and there are two modes of communication basically. One is verbal and one is non-verbal. Non-verbal means either the child will speak through paintings, like a painter has depicted his vision or views. Similarly, either by pointing, either by touch, right? And it is important for us to slowly increase that pointing, cueing, or the non-verbal mode of communication to a verbal mode of communication by helping the child through continuous announcements. Like a child is touching a pencil, one can announce all the time a kind of you can say running commentary, whatever is going on. The child associate the word, like a child takes 1 year after birth to understand what is ma, and for the first time he says ma. Why? Because he is listening from everyone. Okay, you are playing with mama, you are playing with papa, you are in mama's lap, okay, you are taking feed through mama. So that word is initially that the child associate that particular word with everyone, either with dadi, either with papa, either with bua and mami, everyone. But after an association and continuous sparking, the child associate that particular word with a particular lady and calls her for the first time as ma.
So with proper developmental training, can we say ki these special kids can enter normal classes after some time?
It all depends on, based on interventions given in the initial age, that is 0 to 6 year, which is we call it early intervention age. Although there is a discussion on it, either 0 to 3 year is the early intervention age, but